So, welcome back to Boston, Marcel. You spent much of your career at renowned cancer centers here and in New York. So what led you to head west to City of Hope in LA? And what have you learned about the organization in the year that you've been there?
Yeah, so thank you very much for that question. Indeed, I've spent about 30 plus years here on the East Coast. And I had been watching sort of what was happening at City of Hope, specifically within my own field, transplant, CAR cells. There were a lot of interesting things going on. And then over the last years, there was, I would call, a phase of accelerated growth. Suddenly, they started to go national. And they have now cancer centers. We have now cancer centers in Chicago, Atlanta, Phoenix. We have a second one in Orange County, right? A second campus within the greater LA area. We have 35 community practices all over the area of LA. So with that, we're now serving 144,000 patients. I had been seeing that from the East Coast, how that was happening. And I was really fascinated by being part of that and of that journey that a cancer center is on now. So far, it has been amazing. If you would ask me what has been the most striking thing over the first year, I'm going to mention something that I never thought after 30 plus years on the East Coast that I would say, and that is the amazing culture. A word that for many years I would not really use and always thought that it was some kind of business 101 word that people were working with. And that is not just the culture that I see, how we deal with patients, the many gratitude emails and messages that we get about how well the parking guard treats our patients. But it's also about how we deal with colleagues and how leadership works as one team. So those are really things that have stood out for me. And of course, in this past year, and I take no credit for it, it's really done by all the people who have been there for many years, we have risen to the ranks of the top 5 US News cancer centers. And that, of course, puts us in a very special place. And I'm very honored and humbled to be part of that.
So when I think of CAR T and cell therapies, City of Hope isn't the first place I think of, candidly. But I was surprised to learn that you actually do more stem cell transplants and CAR T therapy there than anywhere else. So could you tell us a little bit about your program?
Yeah, it's very interesting. I would call us a sleeping giant in that field. Both if you think about allogeneic transplant and auto transplant, in terms of numbers, we are the largest annually with 850 transplants. We're now close to 19,000 patients transplanted. But the same thing for CAR cells. Many of you, of course, know that Juno was one of the first companies that started that whole field. City of Hope was one of the founding centers for Juno. We had on Wednesday a celebration of our 1,600 CAR cell patients treated at our center. And it's not just a commercial, but it's also a lot of homegrown CAR cell therapies, about a third or so. And we are very specifically set up to develop CARs from our bench to our bedside. We have 3 GMP facilities, which really gives us an enormous power to do that. We have special clinics for that, for instance, so that we have been able to take CAR cell therapy from inpatient to outpatient. So I would argue that we are a powerhouse in both of these areas.
So I want to ask you just a little bit about your own research, because you still have your own lab, even though you're a big shot. And you're studying the gut microbiome's impact on immunotherapy.
Yeah.
Would you tell us a little bit about what you're learning and also what the public gets wrong about this subject?
Yeah. So I think it's one of these areas that has certainly gained a lot of public interest, right? You can read a lot of articles in many media about it. And I think there have been hit and miss efforts from biotech and pharma to put it really into the therapy setting. The area that we have specifically focused on, and I think where there's a lot of promise, is to look at changes in the gut microbiome as a modulator of specifically cancer immunotherapies. We're talking transplant, CAR cell therapy, checkpoint blockade. And a wealth of studies from my lab, but also from many other labs over the last 15 years, have really indicated that if you think about the efficacy and the toxicity of these three therapies that I just outlined, it's a major modulating factor. So I would go one step further, that if you are developing, for instance, a new checkpoint blockade therapy, it's almost a mistake, maybe a little bit harsh to say that, if in your correlative science, if you would not be looking also at changes in microbiome, because we know by now that that will have major impact. Of course, the next step, and that is where biotech and pharma are still struggling to get that really right, is what do we do in terms of therapies that target the microbiome? I think we're seeing some progress, specifically if we take it to a more scientific level and are working with consortia. But the other area that we can look at is, of course, diet. And look at diet not only as a way by which you modulate how many proteins and carbs and whatever you get into your system, but also as a drug of how you, within 48 hours, can change the whole composition of your microbiome. So those are things that we're working on within my lab, both in mouse and man, trying to get into these trials. Moving now to City of Hope, we've set up a center there. And specifically, we want to use it also within the context, as I hinted at already, of our trials. And at City of Hope, we're working at the moment on a national network of clinical trials in all 5 centers, really try to make it easy, both for biotech and pharma and our own trials, to go national with a single IRB and so on and so on, and offer state-of-the-art correlative science. And one of the new elements that we would have there is what we just discussed, microbiome.
Mm-hmm. And when we talked last week, you had some pointed thoughts about what us in the media sometimes get wrong about this line of research. So in the time we have left, throw it open to you to
I don't want to be too harsh about that. That's not nice. No, I think what it speaks to, and I said that already, is that there's a huge public interest and interest by patients. As a practicing doctor, it always strikes me that when you talk with patients about their cancer therapy, at one point they will be talking about what should I eat, doctor, what should be my diet. And then you go into what are the guidelines for diet, even for a transplant, and it's pretty bland, because we don't know that much still about what is truly a diet that would modulate microbiome and other things. So I think there's a lot of work that needs to be done, and we need to take it out of the health food store area and bring it back into science.
Very good. Well, thank you very much for being with us today.
Thank you very much. Thanks.